Right. I'm assuming you can see my slides and hear me very well. So let me get on to the presentation itself. I thank the organizers for inviting me today to talk about how AI can be applied in healthcare. What's the path in terms of applying AI in healthcare? This is an area that I'm interested both as an academic and as an entrepreneur. So I'm very delighted to be here today to talk about it. So the outline for today's presentation is, I assume that most of you do not come from a technical background, so it'd be important for all of us to know what is AI, what's the definition of AI, what's the different types of AI, and then we'll look at why should we consider AI in healthcare, what's the necessity to consider this novel technology, and then we'll talk about translational aspects of AI, how do we actually apply and utilize AI going forward. I would like to keep aside a significant time for question and answer sessions because obviously you'll be curious about how AI can be applied in healthcare, and I would like to be available to respond to your questions. So what's the definition of artificial intelligence? There are many definitions that are floating around, but I like this definition, which I myself confess I have devised. It's very simple, but it's very true in terms of it capturing the essence of artificial intelligence. What it says is, it says machines assuming human-like intelligence. You can replace the word machines with computers. It doesn't make a difference, but the definition is machines assuming human-like intelligence. And that's what artificial intelligence is all about. Now, a lot of us think artificial intelligence is a new phenomenon. It has been around only for the past decade. But in fact, the concept can be traced back to Aristotle's time, Aristotle's concept of syllogisms in 300 BC. So the concept has been around for a long time. Only in the past 70 years that there was a much more formal process in terms of developing AI, and that goes back to Alan Turing's concept of Turing machine, and following that there was some work towards developing early concepts of deep neural network, deep learning, and then afterwards in the recent years that we have started to see more and more attention paid to artificial intelligence. But please be sure that artificial intelligence as a concept has been around for a long time. Now, you may ask me, why is it that artificial intelligence has been only lately noticed? There are really some strong reasons for that. One strong reason is the emergence of hardware that can support the running of AI models or machine learning models. And one of the hardware is graphical processing units. And these graphical processing units were previously used for gaming purposes, but now people have realized it can run AI models very well. So that's one of the key reasons why we have started to lately see more and more attention paid to AI. In the past, we didn't have that kind of infrastructure to run AI models. The other key reason why we see a lot of attention paid to artificial intelligence is the emergence of big data. Big data characterized by volume, velocity, and variability. Whether it's in medicine or in other sectors, we see a huge amount of data being accumulated, and traditional algorithms or software programs can't necessarily analyze that kind of huge amount of data. That's why we rely on AI or machine learning models nowadays. The third and very important aspect is the availability of funding. Without funding, it's very hard to progress research concepts or whether it's industrial concepts. So in that regard, we also have seen in the recent years huge amount of funding poured into AI projects. Let's delve a little bit more deeper into the hardware end of things in case some of you have that engineering bent of mind. So we know that computers come with central processing units, and nowadays they also come with graphical processing units, but central processing units can pretty much run the ordinary or the basic kind of algorithms. But when you're looking at deep learning models or huge amount of data, central processing units become inefficient, and that's when we switch to graphical processing units. In fact, there's a multi-billion-dollar industry around graphical processing units. You may have heard of NVIDIA, AMD, and so forth. They all sell GPUs. So in addition to GPUs, there are other hardware aspects that need to be considered that include FPGAs, FPGAs, application-specific integrated circuits, analog integrated circuits, spintronics, and memristors. Don't worry if you don't remember all of it, as long as you remember that GPUs play a huge role in terms of galvanizing and progressing AI. Now, what are the different types of AI? Again, if you go to different textbooks or different people, you get different categorization of AI. This is my categorization. It's simple but easy to remember. So there's two categories. There's machine learning and there's robotics. Why should I focus on machine learning? Machine learning is the most commonest form of AI used nowadays. Anywhere you see any publications or any research or industrial developments, it relates to machine learning. So what is machine learning? Instead of me giving you a textual definition, let me point you to this illustration where you can see on the top, traditional programming or your average software programming. In that case, what you do is you feed in the data, you feed in the rules, that's the algorithm, and then you get the output. But in machine learning, what you do is you feed in the data and identify what are the expected results. The machine itself devises the rules. It learns from the data. That's why it's called as machine learning. And that provides an advance compared to traditional programming. And there is a advanced form of machine learning where there is a lot of hype and a lot of progress seen, that is deep learning. So deep learning has a computational architecture which resembles our human brain. If some of you have had a medical background or acquaintance with how a human neural network looks like or a human nervous system looks like, they can see some similarities here in the computational architecture. So because of that architecture, you have layers of neurons which are interconnected. So this provides an advantage compared to classical machine learning models because you have that layers over layers and that leads to better performance. On the other hand, the flip side is that because of the additional layers, it also provides some opacity in decision making. Why is that important? We'll talk about it later. Now, how are AI models trained, or how is machine learning further categorized? The way you categorize machine learning is in three categories, subcategories. There is supervised learning, unsupervised learning, and reinforcement learning. Supervised learning is when you label the data, you annotate the data. For example, if it's a medical context, you're utilizing X-rays or MRIs or CT scans, you label it for what it is, whether it's a condition, medical condition or whatnot, and then you feed the data into the model. The model is then trained on that labeled data to recognize new data and identify whether it fits into that particular category. In unsupervised learning or semi-supervised learning, what you do is you basically provide data which is unlabeled. You don't annotate the data. You expect the AI model itself during the training to cluster similar kind of data together. And then when you later on deploy the algorithm in the real world or elsewhere, it similarly tries to identify data which is similar together and groups them together. It's called as unsupervised learning. This is the more advanced form of machine learning, so to speak, because you're not actually labeling the data and expecting the AI model itself to group the data. So it's a bit more advanced than the supervised learning. And then there is the third category, which has become popular nowadays. You may have heard of DeepMind and their application some years ago called AlphaGo, which bet the reigning Go champion in the world. So they use reinforcement learning, which is based on a process of trial and error. And when the trial and error occurs, the AI model then learns to identify the particular result, and based on that, it is able to service the customer. And that's called reinforcement learning. Now, that was a brief overview of what AI is, what are the different types of artificial intelligence. While it's not exhaustive, it should give you enough idea as to what we're going to be talking about in the next many slides. Now, let's come to the important point and the topic for today. Why should we consider artificial intelligence in healthcare? There are already many technologies, there are many solutions that are being proposed. But firstly, why should we consider even any solution for healthcare? Is healthcare without problems? No, there are many problems in healthcare. For example, if you look at certain aspects like limited access to high quality healthcare, whether it's India, whether it's Australia or any part of the world, there is always a premium placed on terms of accessing specialized medical care. If you live in regional and rural areas, it's unlikely you may be able to access tertiary level or quaternary level of care, which is requires specialized medical specialists. And most of this kind of services are based in urban areas. So it becomes really, really hard for people living in villages and rural regional areas to access this. That's one big issue, right? So the second issue is in relation to medical errors. And this is becoming gradually very, very important and significant, more importantly, very risky for healthcare delivery. We are starting to see increasing number of errors, human errors, whether it's because of doctors or because of nurses happening. It may be because of wrong medication being given or a wrong surgical operation being done. So it amounts to medical errors, and that leads to patient harm and impacts on the patient safety. So that's another reason why we should consider alternative solutions or alternate technology. The third reason is in relation to workforce shortages. We know that it takes a long period of time to train medical doctors, and for these medical doctors then to become medical specialist requires an additional amount of years and training. So it's not just with medical doctors, but also other healthcare professions require a significant amount of time for them to be trained and then to practice in the real world. Because of that long time, there is always going to be a mismatch between the demand and supply. There's going to be more demand than supply. So that's another issue facing healthcare services. The last one may not be applicable to India, but is definitely applicable to many other countries like the United States, where there's a requirement for doctors to document all the episodes they deal with or the encounters they deal with the patients systematically. And that adds an administrative burden to the doctors, and that can lead to physician burnout. So definitely healthcare has a lot of issues. If you think that was the only issues, hold on, because there are more issues that healthcare faces. For example, we have an increasing aging population, whether it's in India or whether it's in other parts of the world. We're starting to see more and more number of older people. How is that important for healthcare? It's important because healthcare normally is not oriented to servicing older people. It's more to oriented towards middle age and younger population. But now the health service has to be reoriented or readjusted to treat and manage older conditions. And when you talk about older people, they have chronic diseases, comorbidities, multiple requirements for multiple medications, that is called as polypharmacy. In addition to that, health services have to prioritize these diseases and develop specialized workforce to treat older conditions. So therefore, it's important to be cognizant of the growing aging population, and the health service also has to orient themselves to it. The next issue, if you thought those issues weren't enough, this one will really nail the coffin. Because you see now chronic disease is increasing exponentially. In fact, World Health Organization has stated chronic disease burden is the biggest challenge health services face. So when you look at the statistics, 60% of mortality and 46% of global burden is because of chronic disease. And then when you look at the spending, healthcare spending, about 75% of healthcare spending is on chronic disease. So that gives you a kind of quantification of how big the chronic disease problem is. Put together all of these issues, they definitely pose a challenge for health services, policy makers, governments, and so forth. People are really running out of solutions, and I propose AI is one of the solutions. Why so? Let's look at. Before we get into how AI gets used and how AI can be a solution, let's look at the history of use of AI in medicine. As with AI generally, AI in medicine also has been around for a long time. For example, if you go back to 1970, William Schwartz, an influential physician at that point of time, published a paper where he talks about use of computing technology or software algorithms to help with medical problems. And since then, there has been more and more attention paid to the use of AI, the role of AI, and how different AI technologies can be used in different aspects of medicine. And that's what we will spend some time today. Now, what are the different types of areas where AI can be used? At a very, very high level, machine learning, which we have learned earlier, can be used for patient record management, personalized medicine, patient monitoring, natural language processing, which I will talk about a bit later, can be used for virtual health assistance, note taking and transcription. And then computer vision, which is a very popular AI technique, can be used for radiological and histopathological image analysis. And then there are robots. I'm not talking about the mechanical robots that have been existent pre-AI. I'm talking about the embodied AI or the robots which have utilized machine learning algorithms. They also can be used for robotic surgery, emergency medicine, and so forth. Now let's spend some more time on a couple of areas which are very important in terms of AI in healthcare, where AI is being actively used. And those areas are medical imaging analysis, clinical decision support systems, and NLP applications. So the reason why I'm spending a lot of time is this is where AI is going to be utilized extensively now and going into the future. So what is medical imaging analysis? It's nothing but use of computers or artificial intelligence to interpret X-rays, MRIs, and and other medical images. But the concept of using computational algorithms or AI algorithms in interpreting medical images is not new. It has been around for a long time. So here, in this case of AI, we're starting to use something called convolutional neural networks, which is a form of deep learning, which is very, very good in interpreting pixel-based data. And that has shown a lot of promise in identifying areas where there is abnormalities, whether it's in X-rays or histopathological slides or in MRI scans. So how does a convolutional neural network work and function? Here you see a representation of how the convolutional neural network, or in short, CNN, works. What it does is it breaks down any image, whether it's a medical image or any other generic image. It breaks down the images into parts and then tries to identify the areas of importance and then regroups the image together and presents it to the end user. There's much more technical details to it, but I think for today's purpose, you get a bit of idea how the algorithm functions. And this algorithm has been proven to be time and again to be very, very good in identifying any relevant areas in whether it's in X-rays, fundoscopic images, MRI images, histopathological images, and so forth. And not just that, it can be used in other images also. So it's very, very good in image interpretation. In fact, when you look at studies where they have utilized convolutional neural networks to analyze medical images, they have performed as good as doctors. In this case, what you see is the results of a convolutional neural network used for identifying diabetic retinopathy. That is it's a condition of the eye caused by diabetic complications. So here, the convolutional network is used to interpret a fundoscopic image, which is the photograph of the back of the eye, and the performance has been found to be equivalent to that of an ophthalmologist. So its performance is nearing to, in certain instances, even exceeding that of the doctors. So you see the maturity in terms of how AI can be used for interpreting medical images. So the next area that I would like to focus on is clinical decision support system. So what is a clinical decision support system? It's nothing but a computer or a software that is used by doctors or healthcare professionals to help them with their treatment and management of patients. So even before AI, there were other kind of clinical decision support systems that are used by doctors. But in that case, what happened was the software algorithms were not powerful enough to analyze all kind of data, whether it's imaging data or textual data. But now with the emergence of machine learning algorithms, which are more powerful than traditional programming, they are much more equipped to be able to analyze huge amount of data, but also give personalized recommendations. So these kind of clinical decision support systems which utilize AI are called as non-knowledge clinical decision support systems. And coupled with, or in line with the emergence of non-knowledge clinical decision support systems, is the utilization of electronic health records. Electronic health records provides a platform, or in other words, an ontology from which clinical decision support systems can draw their data from. So together, there will be, because of these two phenomenon, there will be increasingly more number of clinical decision support systems that utilize AI that will emerge in the market, but also get utilized by doctors. Now, why should we consider AI-driven clinical decision support systems, both from an entrepreneurial point of view, but also from a health point of view? That's because of availability of complex medical data. At this stage, there is no medical doctor in the world who can put their hand on their heart and wholeheartedly say they know everything about their subject. There's huge amount of medical data, medical knowledge out there, and no doctor can say they know all about everything. But in that case, how would they be able to get the relevant insights when there's huge amount of data that's coming in through? That's where clinical decision support systems can filter out the noise and help the clinician in identifying the relevant information, whether it's the patient data or whether it's medical guidelines. So that's where AI-driven clinical decision support systems can play a huge role. And there is also emergence of technological platforms where machine learning models can be developed very easily compared to, say, 10 years ago. Now we have a lot of open source open access platforms that can be used to develop clinical decision support system or generically any AI models. Further to that, now we have also professional societies and online communities that can support you in developing clinical decision support systems. Coupled with this, there are other aspects in terms of funding, research happening in this area. So altogether, they support the use of AI-driven clinical decision support systems. Now, when we look at where clinical decision support systems are being used, AI-driven clinical decision support systems, they're being used obviously to analyze images. We already looked at that in our previous slides. They're also being used to predict the onset of certain medical conditions, to analyze the risk of emergence of a certain condition, and they're also being used for voice interpretation and text interpretations to the form of natural language processing. And the type of algorithms, when you look at a review that has been done, they identified the different types of AI algorithms that were utilized to develop this clinical decision support systems. Surprisingly, the leading algorithm is a very simple algorithm called logistic regression. Some of you with a maths background or stats background may recognize this. It's a very simplistic machine learning algorithm or a statistical model, and it actually leads other advanced form of machine learning models, even compared to regression trees and compared to deep neural networks. So you can see even you can develop clinical decision support systems with simple algorithms. Now let's look at a case study or an example. Our company was asked to develop a clinical decision support system to help doctors in Scotland to identify those patients who require referral to ambulatory monitoring of blood pressure. So for those who do not come from a medical background, let me explain what this situation is. So in order to confirm somebody has blood pressure, in certain times, what you do is you refer the person to wear a mobile device, or in other words, ambulatory device to monitor your blood pressure overnight. This may sound good. In practice, what happens is that when you wear that particular monitor, it is there throughout the night, and it keeps on measuring your blood pressure at regular schedules. Because of that, it can cause much inconvenience for the patient to wear it. So you want to be careful about who you refer to that particular service, and you want to make sure the persons you're referring is indeed at a very high risk of developing hypertension or has hypertension. So they wanted a model to be developed to identify those patients. So we took on the task, the company took on the task. First, as you may know, as you may have realized from previous slides, we need data in order to train the AI model. So the kind of data that we were provided included demographics, the cardiovascular disease risk score, the different classification grades of hypertension, and classification of ambulatory monitoring of blood pressure. And then we vectorize the data. In other words, we mathematize the data, we convert it into numbers, and then we place the results that we wanted to get from the model. They included hypertension. Masked hypertension is when you have hypertension, but when you go to the doctor or when you go to the clinic, you do not seem to have hypertension when they measure your blood pressure. White coat hypertension is the opposite. You do not have hypertension, but when you go to the clinic, your blood pressure gets elevated. That's white coat hypertension. And then you have normal pressure and normal blood pressure with white coat components. So these are the categories that they expected us or the clinical decision support system model to provide as an output. And then we used five different AI algorithms separately to develop this clinical decision support system. They were developed in parallel and they were not connected with each other. So we use support vector machine, random forest classifier, XGBoost classifier, decision tree model, and deep learning models. So don't worry if you do not come from a technical background. The names are just different AI models. And then when we looked at the results showed that the XGBoost model performed the highest, even compared to deep learning. Normally, you would expect deep learning with its advanced computational architecture should do better. But in this case, an XGBoost model did much better than a deep learning model. The reason is deep learning thrives on huge amount of data. The more data you feed into the deep learning model, the better it performs. If you get small to mid-sized data, deep learning is probably not the ideal algorithmic model that you would like to utilize. You would rather rely on other kind of AI models. So that was in brief clinical decision support system and what doctors can benefit from clinical decision support system, but how AI can be used in developing clinical decision support systems with an example. Now let's look at natural language processing. And there's going to be huge amount of activity in this area in the coming years. Why so? Because in the recent years, there's been some advanced developments. You may have heard of GPT-3 developed by OpenAI, which can basically write poems, do some elementary coding, and even complete if you write a few sentences, it can complete the rest of the paragraph. So it's come to that level of prowess, NLP. So what is natural language processing? It's nothing but computers interpreting human language, whether it's oral or written. So now we are utilizing that technology in medicine. And the way we use it is by using it as symptom checkers. You may have heard of medical chatbots, but you may have heard of these companies, Babylon and Sensely, which have symptom checkers. What it does is you download the app, and then you feed in your complaints. You say you got a chest pain and you got a shooting chest pain and you got it you've been having it for the past many days. It may be able to give you a differential diagnosis, whether it's myocardial infarction or it's a pneumonia or pneumothorax and so forth. But what it does is basically it triages the condition and then gives you a recommendation whether you need to go to the hospital or not. In this way, it can avoid you necessarily having to go to the hospital. In fact, in the UK, they're already using to triage patients so that there is not undue burden on the hospitals. Similarly, in the US, there is a counterpart called Sensely, and they have an avatar, a virtual nurse, which can triage your conditions and identify what is affecting you. Natural language processing applications are not restricted to symptom checkers. They can be used in other areas. For example, we are launching a diabetes management software where we utilize natural language processing to help the patients connect to the doctor, help the patients to adopt healthy lifestyles, adopt a healthy diet, adopt a healthy exercise regimen, but also intelligently organize scheduling of the patients to visit the doctor. But this is in the context of diabetes, but this can be used in other areas, in other chronic conditions too. But we use natural language processing application to help us with the patient being adopting healthy lifestyle, but also connecting the patient back to the doctor. So that helps in terms of providing continuous care for chronic conditions and diabetic patients. So let's pause here for a while. We've looked at what AI is, what are the different types of AI, why we should consider AI in healthcare. Then we looked at how AI gets applied in healthcare, focusing on three areas: clinical decision support systems, medical imaging interpretation, and natural language processing. Of course, AI gets used in other areas of healthcare too, but these are the three main areas where AI gets utilized and how AI gets utilized. But now let's look at the headlines what are coming out, whether it's in scientific publications or in the media. Here we see Nature, which is a top medical journal, saying AI outperforms radiologists in mammographic screening. You also see in the general media saying AI is doing better than doctors. But is it so in reality? Not so, because there are a lot of challenges in terms of adoption of AI. And some challenges are, For example, in medicine, we use a causal deterministic model. That means we have to be really, really sure in terms of us approaching a particular patient in terms of whether it's therapy or whether it's a surgical intervention and so forth. We have to be really, really sure because otherwise we will be harming the patient. But AI, the way it performs currently mathematically is based on pattern recognition and prediction, which is a bit of like probability based on probability. That means there is a lot of chance taking in the way AI approaches things. So that kind of thing can become risky in medicine. That's one challenge. The other challenge is when AI gets trained on a particular set of data, it doesn't mean that it's going to be able to perform generically very well, or in other words, it cannot perform. We are not very sure it can perform as good as on the local data, whether it's going to perform on different data. So that means it can't be generalized and it can't be, there is a non-representational issue happening there. The other issue that have emerged in the recent years with the use of AI is that people have noticed if improper data is used, non-representational data is used, it can lead to discrimination against particular populations or particular genders. In fact, that's already been seen in the US, where some AI models have discriminated against minority populations like African Americans. So there is that risk. The other issue, if you remember when we were talking about deep learning and its architecture, and we talked about how layers can enhance the performance of the model, we also talked about how that layers can also lead to opaque decision making. In other words, non-transparent decision making. This poses a problem in healthcare. When you go to a doctor and he or she recommends a treatment, you can ask the doctor or nurse or healthcare professional why that treatment was recommended. And the healthcare professional can explain. But if AI makes a decision and it can't explain why the decision was arrived at, it can pose a problem. And that's the lack of transparency in those kind of models. And going into the future, it might be that AI is performing better than doctors and the healthcare service decides, actually AI can replace doctors. And it is going to be also a risk because if things go wrong, then we don't have any control over AI, right? There's no oversight over AI. So that can happen too. When I mentioned trust here on the slide, I'm talking about not just trust from the patient end of things, but also from the doctor's end point of view. From the patient, they may prefer doctors who utilize AI. They may go to a doctor who utilizes AI and not go to a doctor who doesn't utilize AI. That's already happening in a couple of countries where they're seeing patients preferring doctors who use AI. And from a doctor's point of view, the doctor may not trust AI, even though it's performing better or as good as them. They may not trust it and they may not use it. If they don't use it, then it doesn't matter how good the technology is because it's not getting used, it's useless in that sense. And in addition to ethical challenges or regulatory challenges, I think except for United States and UK and certain countries, many countries have still had to work out how to approve the use of AI in healthcare. How can AI be safely used in healthcare, regular healthcare? So those kind of regulatory issues are still to be worked out. And I think it'll take some more years before they get it right. But US is already leading the way and showing how to do that. So maybe we all can learn from that. And there's another issue about use of data. When we use data, we have to make sure that the data that gets used for training of artificial intelligence is not breaching the privacy of patients. Why do I say that? In fact, there have been instances in the United Kingdom and United States where they have utilized patient data without their permission to train AI models. And it's only after they trained the AI models, patients came to know of it, and there was a huge uproar and cry about it. So we have to be careful in utilizing data. If we at all utilize data, we have to make sure that the data is anonymous. It can't be traced back to the patient. So there are also legal challenges. Legal challenges can be exemplified when things go wrong. If an AI model gives you a wrong diagnosis or worse, leads to harm to a patient, who can be held responsible? Is it the software vendor? Is it the hospital? Or is it the physician? So those kind of legal kind of conundrums haven't still been resolved. They have to be codified. They have to be introduced into law. There's still some work to be done in that area. So that was kind of like a quick run through the challenges. There are much more challenges. I don't want you to be kind of let down by me talking about the challenges. The challenges are there, but there is also solutions. So solutions can be many. For example, all those ethical, regulatory, and legal challenges that I talked about, there are solutions. And I've covered that in my paper in detail. You can go to the Journal of American Medical Informatics and Google my search for my name, and you should be able to get that paper. That paper goes in detail as to how to address each of those challenges. So I recommend you to refer to that. But quickly, I want to refer to that framework that we propose in that paper. That includes components like fairness, transparency, and trustworthiness and accountability. Each of them are able to address those issues that we mentioned earlier. Also, there is work being done elsewhere in terms of identifying solutions to the challenges that we talked about, including developing this kind of pathway where it allows for continuous monitoring and evaluation of AI products. Such in that way, if things go wrong, there's an ability to intervene early, but also fix that issue. Now, moving forward, how do we address in a stepwise manner these challenges? I believe first challenge is to address the technology issues, and then you have the infrastructure issues. What do I mean by infrastructure issues? Not all hospitals or healthcare services are ready to deploy AI. Even if the AI model is ready, the hospital may not have the infrastructure to run the model. So you need to have the hardware, the software, the expertise in the hospital or the healthcare service to run the AI models. That also has to be resolved. And then there has to be a governmental policy to allow the use of AI in healthcare. That also has to be introduced. And then finally, there has to be a governance or a safety and quality mechanism to ensure that if things go wrong, there is an ability to correct that, but also to prevent any things going wrong. So let's pause here for a moment. So we've seen what AI can do in healthcare. We also seen the challenges. We also talked about solutions. So let's take an assessment of what's happening around us in terms of AI in healthcare. So let me point out this figure where you can actually see the number of AI applications approved for clinical use by the Food and Drug Administration, which is the regulatory body in the United States. There are plenty of them. We can already see 30 or so that have been approved by Food and Drug Administration. And I believe in the coming years, they will see more and more AI applications being approved for clinical use. This is not AI that is being used in laboratories or research institutions, but actually approved for use in clinical environments. So you'll start to see more of this being approved and start to be adopted by clinicians. In fact, the US government has recently allowed for reimbursement of use of AI in healthcare, AI being used for identifying stroke patients. For those who come from a medical background can understand the importance of identifying stroke patients very early on, so intervention can be done, especially in terms of thromboembolic stroke, because you have minutes before the brain can damage. In fact, now US government is saying they approved an AI application for use in terms of identifying stroke patients. So that will open the gates for more and more AI applications to be reimbursed. Especially in the US, reimbursement plays a huge role in terms of adoption of AI. Further to that, last week, the Food and Drug Administration also issued a white paper advocating how they're going to be monitoring and evaluating AI. And while that is a regulatory process, it also shows that the Food and Drug Administration is placing a lot of importance and supporting the use of AI in healthcare. Now, coming to the close, if somebody were to ask me and ask me, say, where is AI at in terms of different areas of healthcare? I would say AI is quite mature in terms of being able to interpret medical images. In fact, there's been ample amount of evidence to show that AI can be used very effectively, if not meeting the performance of the doctors, but close to the performance of doctors in interpreting X-rays, MRIs, and CT scans using CNNs, right? In a couple of years, I can say there will be more and more use of AI-driven clinical decision support systems. We talked about a couple of examples previously, but 25, 30 years from now, we may start to see more autonomous AI applications, including surgery. In fact, there are trials being held currently in California for autonomous robotic surgery, like, for example, simple surgical interventions like laparotomy, minor suturing, and so forth. So to summarize today's discussion, we know that healthcare has a lot of challenges, issues, and people are looking for solution. I proposed artificial intelligence as a solution, and it's not without merit. There is a lot of merit. We discuss the details. It's not just hype. There is also substance in what we talk about AI in healthcare. However, we need to be mindful of the challenges. We need to be cognizant of the challenges that we face in terms of adoption of AI in healthcare. Having said that, we talked about solutions. Using that solutions and using an appropriate pathway, we are going to see a lot of benefit from using AI in healthcare. Finally, before I conclude, in case you are interested in AI in healthcare, I recommend you to refer to these two books. The book on the left is written in an easy to read language. You can buy it online. It shows the progress of AI in healthcare from conception to utilization in various aspects of healthcare. Pretty straightforward, very economical to buy. The next one, which is on the right, is more academic in nature. In case you want to go in more details, you want to look at the technical details, the academic details, research details, then I refer you to the book on the right. That again is also available online if you want to purchase it. So now I will finish my presentation and be available for questions.
Thank you, sir, for addressing us. I think you covered all the points during the session, but we have taken some questions from the participants during the registration. So if you permit, can I convey the questions to you?
Absolutely.
Okay. So the first question is how AI is going to adapt itself in DNA mapping in near future.
Yeah, so you're basically talking about utilization of genomic data to help tailor the current medicine approaches. What they do is they use a blanket approach. So they use the same approach for everybody. Say, for example, if you're talking about diabetic patients, we go with early healthy lifestyle changes and then we put them on oral hypoglycemics and then we go with within that the same kind of medications. But what if that particular patient was resistant to that kind of medications or their body DNA profile or genomic profile was not adapted to that medication? We don't know about it. So we need to tailor the medication. But to do that, it's very expensive to do that, and we don't have the time and resources to do that. But with the advent of AI, what it can do is it can draw upon the genomic profile of that particular patient, be able to identify not only what is that kind of treatment you would like to provide, but also identify the potential risk factors. So that is what is called as personalized medicine. So AI and personalized medicine hold a lot of promise in the future.
The second question is that how AI useful as medical assistance and can AI take the place of medical team in future?
Yeah. So the two aspects to that answer. One is whether AI can provide medical assistance. That, as you may have seen in the presentation, it's already being done through symptom checkers, through clinical decision support systems. We are already seeing that. So the second aspect of the question is whether AI can replace doctors or can replace some activity of the doctors. I think AI is already replacing some activities of the doctors, especially radiologists. It can do primary screening of X-rays. It can identify where the issues are, and then you can have a radiologist look at that particular result and confirm whether it's accurate or not. But in going into the future, it's likely that more of activities of doctor can be done by AI, especially the ones which require routine kind of things, and allow for the doctor to come into the picture at a later stage. And what it means for busy doctors is that kind of routine, mundane kind of screening activity can be done by AI. And when there is requirement for a human kind of correspondence, human intervention, then doctors can come into play. So that might happen in a couple of years from now.
Thank you, sir, for answering the questions. These were the two questions which we took during the registration process. So I think these two questions cover the your topic. And now I would request Prashant, sir, Manager AIC-BHU, to kindly give a vote of thanks. Welcome.
Thank you, Dr. Reddy, for taking the session. You explained about the medical imaging, clinical decision support system, natural language processing. As a layman, probably I have seen the Hollywood movies predicting the future of technology and the artificial intelligence in terms of the medical and other aspects, but you have very well explained how the world is going to change and how the artificial intelligence and technology is about to take the place of human and can benefit and will be benefiting the humans as well. Thank you for giving your time. I hope everybody has enjoyed the session, and probably will be like to be connected with you for future as well. Thank you.
And thank you for having me. I will leave my, I think the organizers already have my email address. If any of you are interested in AI and healthcare, please feel free to contact me.
Thank you. Thank you, sir.
All right. Thank you. Thank you all.